facility will be one of the premier facilities that we have, because this facility serves more than 160,000 people in the outpatient per year and 150,000 people in the special clinics. We have an inpatient capacity output of nearly 30,000 a year, with around 6,000 deliveries every year. So this hospital has been the beacon of specialized services in this region. And we are going to ensure that some of the challenges that this hospital has had, particularly in the service delivery, cancer service delivery oncology, because the bunkers were not completed, they are 70% complete. The issues around cardiology services, the issues around nephrology services. The hospital has a very functioning kidney dialysis, but still not yet on the transplant. We are taking over some of those functions and making sure that before the end of this year, there will be a different story. As you all know, the 20 counties around this region, the Lake Basin region, have the highest burden for cervical cancer. And cervical cancer requires that you have radiotherapy machines. So we have a bunker here, and we are going to make sure that as we take over, we prioritize those services. The Moi Teaching and Referral Hospital has been overwhelmed for quite a long time because they have around 150 patients per day lining up for that radiotherapy. Kenyatta University Hospital has around 100 per day, and so is Kenyatta National Hospital. So you can see the burden is quite high on the Moi Teaching and Referral Hospital. And because the cabinet has already made that decision, we will make sure that the people who are traveling from this region that are going there, they get those cancer services here. And those are some of the priority areas that we've looked at. We've looked at the priority areas around cardiology services. We've looked at the issues around maternal and neonatal services. And we've looked at also the issues around training and research. This facility has already engaged with Maseno University, and so we are going to look at how we share some of those specialist resources. There are 42 specialists here, and there are another 40 specialists from Maseno University. And so part of our human resource transition management is to ensure that that process is seamless so that the region benefits from the services. Of course, we have also looked at some of the challenges that we have, particularly the challenges of disease burden that is quite high in the region. Of course, you all are aware about the stop work order of the United States government that has affected some of the services that are around here. And so we are working on a mitigation measure to see to it that the facility is resourced to meet that gap.